Here are 4 important carpal tunnel exercises that help to avoid surgery. Number 1 is grip strengthening. Get a grip strengthener just like this. There's one linked in the description below. You can adjust the end of it right here to move the spring back and forth and change the resistance. Set it to the resistance that is difficult enough for you to not very easily close the handles. That's too easy, I can close the handles. And what you're trying to do here is strengthen the muscles that are in your palm, specifically the muscles at the base of your thumb right here and at the outside part of your palm under your pinky. Getting those muscles together like this using the grip strengthener really helps to fatigue them and lift the tunnel, the carpal tunnel right here off the median nerve. Once you have the right intensity, and you're shaking to do it, hold it for 10 seconds, repeat 10 times, and do this hourly as long as you don't have any problems, any pain. If you do have pain problems, then do it for less than 10 seconds. Start out with a few seconds, see if you can get up to 7, 8, 9, 10 seconds. And you don't have to do this hourly at the beginning. You can work your way up to doing it hourly. You can also do less than 10 reps each time you do this. Find what works for you to start out and then work your way up to doing about 100 reps a day or more. Next is shrugging. The nerves that come out of your neck right here and go under your collarbone are the ones that end up going down to your hand where the median nerve that gets trapped in the carpal tunnel is. So if you can get your shoulders up overhead and then shrug as high as you can, hands up overhead, and shrug your shoulders up in your ears and get these muscles right here, your shrugging muscles, to activate and work without letting your head and chin jut out like this. You have to keep your head over your body. Then you can really get the shrugging muscle stronger to lift your collarbone off the nerves that get compressed under that collarbone. That will help alleviate pressure down the entire pathway of the nerve. You want to do 10-second holds and hold it for 10 reps, and along with the grip strengthening exercise, do this hourly as well. You can adjust how long you hold it and how many reps you do, and you eventually want to work up to doing about 100 plus reps per day. The second exercise is more of a stretch, but I included it in here because it's very important. Get a pillowcase like this one, fold it in half the long way, fold it in half again the long way, twist it up to make it like that, wrap it around your neck, hold on to the ends, and then you're gonna unstiffen your neck by pulling over across this way and turning your head at the same time. You can really focus the pressure on your stiffest neck joints and allow your neck joints to free up. Sometimes it'll even pop or crack in a good way, a way that frees up more motion, and you can just oscillate and hang out there. No more than 20 or 30 seconds is necessary each spot you do it on. You can go up and down a spot if you want. Once you've done this for no more than 5 minutes, even maybe just 2 or 3 minutes, you've probably loosened up your neck enough. You do get diminishing returns with this, meaning the longer you do it, it doesn't really make that much more of a difference. So really just a few minutes is enough time. And this is something that you don't have to do as frequently as hourly. This is something that you might just do a couple times a day, maybe 3 or 4 times a day, really as much as is needed, as long as you're still getting benefit out of it and it's not hurting you or making anything worse. And the last part of this routine to help carpal tunnel syndrome is hanging. Hanging like this really helps to increase your grip strength, which is important, like we established, for that carpal tunnel, but it also takes pressure off your neck and shoulders and your nerves. And I got my feet down on the ground here. I am not giving my full body weight. It's about 50%. And if you can hang like this for 10, 20, 30 seconds, if you can work your way up to doing 60 seconds, then that would be beneficial to get your muscles working in your hand, your nerves offloaded in your neck, and get a good nice stretch to your body. Now this should not hurt you, it shouldn't increase symptoms. In people with very sensitive carpal tunnel symptoms, they will get symptoms with this. You'll get numbness, tingling, and even pain. So you want to not do this exercise if you're getting those symptoms. You need to maybe progress to this by doing the first 3, but once you can do this without any problems, I highly recommend getting to a pull-up bar at the gym or installing one at home. Maybe you already have one, or getting a pull-up station like this one can be very beneficial in getting those carpal tunnel symptoms under control so that you can be healthy, active, and normal again. If you're having trouble reaching the floor from your pull-up bar, grab a sturdy step stool that you can use to get your feet onto. Hey, I hope this routine is helpful for your carpal tunnel syndrome. If it is, drop a comment below. Let us know if it worked out for you, and make sure to not do anything that aggravates your symptoms. Only do what you can that makes your muscles work without causing any more negative symptoms. If you like this video, please give us a thumbs up, share this with somebody you think needs to hear this, and subscribe to our channel. And please turn on our notification bell so that you don't miss out on any future videos that we put out. Thanks so much for watching. I'll see you in the next video. Bye-bye.